If insulin questions are tripping you up, it's not because insulin is so complicated, it's because the questions are actually asking you to predict risk. See, insulin questions aren't about memorizing charts or tables or graphs or numbers. They're actually trying to get you to figure out what the risk involved is. They're about recognizing patterns and predicting risk, and that is clinical judgment. So the next time you see an insulin question on an exam, ask yourself these two questions. First of all, when am I giving it in regards to food? And secondly, when is the peak for that medication? The answer to those two questions is going to give you all the information you need about risk and prioritizing patients. Here's a pattern that many nurses use. The faster the insulin works, the closer it needs to be given to food. So, for example, if you have rapid-acting insulin, you need to give that with the tray in front of the patient. If you have short-acting insulin, the tray needs to be on its way. If you have intermediate-acting insulin, then you have to make sure that there is a meal or a snack coming soon. And lastly, long-acting insulin, the meal doesn't matter. So it really comes down to this. When is the food going to be given in relationship to this insulin? And that will determine your safety and risk. Here's where many students get stuck. They remember the kinds of insulin and how they work, but they forget to look at the peak. And the peak is the danger zone. The peak is where hypoglycemia is likely to happen, and the peak is where patients get into trouble. So insulin administration isn't about memorizing facts and charts from tables and graphs. It's about predicting risk. So know your meal times, find the peak, and protect your patient. Well, that's how nurses think. So be sure to tune in again next week for another Test Tip Tuesday.